Hello, I'm Deborah Quilter. I've written 2 books about repetitive strain injury, and I also consult with people and help them when they have RSI. Today, I want to introduce you to one of my star students who is doing really well. Let's hear what she has to say.
I first noticed something was wrong with my right hand, which is not my dominant hand, and I realized that the muscle between my thumb and my first finger looked like it was disappearing, and my hand was beginning to look like a claw. So I rapidly got myself a physician in town and asked him to refer me to a hand doctor. Well, he didn't refer me very quickly, and so I had to go in and ask again. And when I did get referred, I saw a physician's assistant who, without touching my hand, without a test, announced that I would need at least 2 surgeries, one in my elbow and one in my wrist. Well, I was shocked. I was completely taken unawares that there was something so serious wrong. And I had had some minor pain in my hand, but nothing that alarmed me. I just was more worried about how it looked. So I started calling a few friends and asking for their advice and referrals. And one of them referred me to you. And although you were in New York and I was on the other coast, I still thought it was worth giving you a call. So I did. And what I discovered was that there were some things I might be able to do. Meanwhile, the doctors were insisting that I think about surgery, and I was insisting they think about testing my hand to see if there was really anything wrong, because the woman who prescribed the surgery had not even touched me. She had done nothing.
So she didn't do any hands-on clinical exams, giving you these kinds of maneuvers or tapping or having you turn your head or anything like that?
Nothing at all. But through some friends here in town, I was referred to 2 other hand doctors who did give me some tests, some of the kinds of tests that you're describing. And they recommended that I get an actual nerve test, a nerve conduction test, which I did. And that test, when it came back, which was right away, was that my right hand had moderate to severe nerve damage, meaning my right hand wasn't working very well, and it was due to my ulnar nerve that runs through my elbow.
And
Now,
how did you notice that? Did you have problems cutting things or operating your hand? Tell us
yes,
about that.
the thing that I noticed first was that I was having difficulty using my right hand to cut up an apple. I'm fairly ambidextrous, and so I can cut with my right hand even though I'm a lefty. And when I eat continental style. So I keep my knife in my right hand and my fork in my left, and that's how I eat. I don't switch hands. So the fact that I couldn't cut steak and I couldn't cut an apple with my right hand with a sharp knife was concerning. And I was suddenly seeing my hand contort itself in its effort to make the cut happen. So that was the first thing I noticed. But then I began to realize that doing buttons and zippers was hard. And not only that, I wear earrings in my pierced ears, and one, I couldn't get the post through the hole. I couldn't find it and I couldn't manage it. The tips of my fingers they didn't feel numb, and yet they were numb in some way.
You
And
had lost tactile sensation.
correct.
Yeah.
Um, so I'd lost strength, I'd lost tactile sensation, and I couldn't pick up tiny objects. So there's the back that you put on your earring to keep it from slipping out, and I couldn't do that. So I
Mhm.
had to switch to clothing with no buttons and earrings that would not fall out of my ears. And so it was beginning to be rather worrisome.
And so what did the doctor say, the new doctor?
So the new doctor, I had 2, and I picked one based on a personal interview with each of them. And the one that I picked um, was not in a rush to do surgery. He was very interested that I was working with someone else who was going to give me some exercises and so on. And he wanted to know more about it. But he also did a great deal of testing in the office. He had me do things with my hands, both hands, testing them for strength and for sensitivity on the tips. And he had me move my head and neck in a variety of ways. And I don't remember all the details anymore, but he was very thorough and took a lot of time with me. And he had a waiting room full of people. So I really appreciated that. Whereas the other doctors that I had seen were rather quick and really didn't pay much attention to what I was saying or to testing me beyond getting the nerve conduction test, which was a really unpleasant test, to say the least, but it was only testing one thing, and these were much more broad. So that
And
was
then,
what happened.
yeah, and then we started working together, as I recall. It was pretty soon after you'd had that appointment.
Right. I was able to work with you, and the first thing you did was you took photographs of how I moved and sat and my posture around the house, and when I cooked, when I ate, when I stood, walked, bent over, read books, everything that I might do in my daily life. And I told you a few things about how much I had used my hands in the past. I had been a painter, a fine arts painter, but I hadn't been using my right hand for that, but I did use it to build canvases. I had been a quilt maker. Again, I used my left hand primarily. Um, I had I like to cook, so I used both hands, lifting pans and cutting things. Um, and had been a very, very avid knitter, and that was the most recent repetitive motion that I'd engaged in. I was a fast knitter. I knit a jillion sweaters of all sizes, and I loved it. I could knit in the car. I knit all the time, and
Yes,
I
and you're
realized
making a point about the cumulative
right,
nature of repetitive strain injury. But remember, the first thing I noticed with you was your habit of resting with your elbow bent on a hard surface and resting your chin.
right,
And I remember very distinctly saying, Patty, you must cease doing this. And I showed you how to make a soft splint out of a towel, and you wrapped it with some Velcro to keep your elbow straight while you slept. And as I recall, you woke up the next morning and very happily announced that you were no longer numb.
right.
That was helping heal that nerve because, as you've been saying, your left hand is dominant, but it was your right hand that had gotten injured. And a lot of people do this. They lean on their elbows. And it's
Yes.
something that, if you do that, please don't do that. Stop now.
Well, that was your instructions, and I really tried to. It has been hard. Apparently, even when I'm doing handwriting, which I try to do more of, and then I would lean on my right hand to think about what I was writing, or to even bend my neck over so I could see. As a left-handed person, it's
Yeah.
hard to see what you write if you keep
Well,
it in a
yes,
certain
but
position.
you were covering your hand. So I
Yes,
showed you how to do less pronation. The pronation is the palms down. And so that helped you also because you could sit taller. So
right.
when we were doing the analysis of your handwriting, we showed you how you could straighten out so that you weren't peeking underneath your hand to see what you were writing, but lifting your hand so that you could see what you were writing and sitting tall.
Exactly. I was amazed at how many details you observed about the way I was sitting, how I was writing, how I held my hand, how I held my shoulder, how I held my back. Every part of me was involved in what you were telling me to reorganize. And what was amazing was how quickly my body responded when I actually did those things. And I eventually learned how to sleep with my arms straight. I like to sleep now on my back more than I used to. And part of that had to do with doing the Feldenkrais exercises, most of which are done on one's back, and I got very comfortable with that. And so straightening my arms and learning to relax from the shoulder and neck downward has been exceptionally helpful. And doing that before I go to bed, doing the Feldenkrais exercises for my shoulders and neck, helps me relax when I'm sleeping. And I do still sometimes use that towel around my elbow so it doesn't bend. But for the most part, I don't need to do that much
That's
anymore.
wonderful. And the other thing we did was I looked at your typing technique because you are a writer. And so anybody who uses a computer, we do major typing technique, because this is how people can get into so much trouble and have no idea what they're doing. So one of the things that you did was called ulnar deviation, which is when you're reaching for the keys by twisting your pinky to the right or to the left. It's mostly to the right because that's where all the important keys are. And so we did quite an
Elaborate.
extensive technique retraining with you, and I showed you how to sit, the appropriate height of your chair, the appropriate height and angle of your keyboard tray, how your monitor needed to be. We checked all that out, and then we looked at your typing technique, and I filmed it so that you could see what I was seeing,
Right.
so that you could learn how to correct your technique so that you weren't further injuring yourself. And that's one of the most critical things that I can do for people.
It was really wonderful. You spent really 2 full days with me, and it was worth every penny, because I learned so much and I got to practice with you. It wasn't just hearing it over the phone or in a video. You were right there showing me what to do, and each time I would make the same error that you had just told me not to do, like pulling out my little pinky to hit the backspace. That was one of my big ones. You would say something, and I would have to correct it. And so taking a couple of days for our work together and then setting aside basically 2 weeks to gather all the new equipment I needed, um, and to set it up. And it started with the chair that you suggested. And that chair has been so wonderful. As you mentioned, I'm a writer. And when I retired, I decided I would take a writing degree get an MFA in creative writing while I was doing a lot of work. And that was part of what happened when my hand began to really bother me, because I had a professor who wanted me to write 4,000 words a week. And that's a lot of words at any time, but in 1 week. So I was grinding that out and feeling happy about it until I realized it was making my hand really hurt. And mostly it was my little finger that was numb. That was the one thing that stood out.
Ulnar nerve. You know, it's so lucky that you did this when you did this, because with your technique, you could have gotten so many more varieties of RSI, because each habit that you have can be linked to epicondylitis or ulnar nerve injury or carpal tunnel injury. So you were really blessed.
Well, I was lucky to find you, Deborah, because, if it hadn't been for calling what turned out to be a mutual friend, I would never have known about you unless I had gone online. And I'm not much of a person to investigate online. But there was one thing you told me right away, and that really impressed me. When we talked on the phone, before you even saw what I was doing incorrectly with my posture and my little finger and all of that, you told me that if I didn't really pay attention to all the pieces of this puzzle, if I got the chair, but I didn't get the better keyboard that would help my hands, and if I didn't use my phone differently, so I have a stand I put my phone on, because I was holding my phone and taking walks with my elbow bent and
Yeah.
my phone up to my ear, and I would come away from that wondering why my little finger was bothering.
Yes.
And then
Yeah.
I'd switch hands thinking that was gonna make it better, but it basically what it did was it switched the problem to my left
Their
hand.
hand, exactly. This is the mouse problem. People have trouble with their mouse. They injure this arm and then they use their other hand and they injure that one. It's just
Right. So you have
devious.
to really, as I learned from you, put together all the pieces. It's like a puzzle, and it's not
Mhm.
really finished until you get all the pieces in place.
I
Now the
also showed you how to dictate
you
using your
did.
phone.
And so now I know how to put my phone on its stand. I don't have to touch it. It's on dictation mode. I talk into it and use the numbers beside the different keys to tell it what to do. And I don't have to hold my phone at all. So that's been really terrific. And
Yeah.
I love my chair so much. I got a second one because I wanted it at the dining room table where I eat and I do
I
some.
wish everyone would do that because it really matters. Get 2 chairs, so
Well,
you're not
yeah,
straining yourself lugging it from one room to the other.
I'm not strong enough to lug chairs anymore. I used to be.
Ah,
But I also invited my son and his partner over, and they tried out the chairs, and they were doing a lot of they had gone from jobs where they were very active to jobs where they were sitting a lot, and so they're in their 40s. Well, she's in her 30s, he's in his 40s, and before I knew it, they wanted to borrow one of my chairs, so I got them a chair. They
yeah,
have
you're not getting rid of your chair.
I'm not
You're
getting
gonna
rid of
let
my
anyone
chair, I need my
borrow your
chair. I even took it with me to a residency for my MFA program where I was away for 10 days, and I said, "I can't be away from my chair that long." And
Yeah,
even having it with me, I didn't lug it around, I just kept it in my dorm room so I could use it when I was working at night. But I did get someone to write for me, to take notes. I used the accommodations that were available because of getting that nerve test was actually unpleasantly worth it because the school respected that and the doctor's note that I needed to have someone take notes for me, which I did. So I
yeah.
sat in lectures with my arms at my side, my hands and shoulders relaxed. In fact, sometimes I even did my exercises at the back of the room while somebody lectured and just
Well,
did
now
that.
you're getting to the next thing that I did. I showed you strengthening
Yes,
exercises to help you with your posture, and that is also a critical component of this work that we did together. I showed you exercises and I showed you some restorative yoga techniques to help open out your chest and relax,
right.
and things that will be very good for um, just soothing RSI and helping the healing process go along. So,
Yes, you did.
yes, we
And
did exercises, and then for a real treat, I gave you a functional integration lesson, otherwise known as FI, which is a Feldenkrais technique, where the student is just lying fully clothed, and the practitioner, which would be me, is making gentle movements of your bones. And that, I think, was pretty well. You tell people how that was for you.
well, first of all, it was very relaxing. I didn't have to do anything but lie on the floor. Normally, there would have been a table, but we were in a situation where we didn't have a table. So Deborah got down on the floor with me. But in having that functional integration experience, I began to realize that my ankle on my right side and my knee, which had always been problematic, even when I was a child, I sprained my ankle a great deal and my knee was wonky. I began to realize that they were connected in the way that they were turned out abnormally to what was going on with my left shoulder and my neck. Who knew? And it was through the neck that my ulnar nerve ran. And so, therefore, the problem with my ankle and my knee being out of whack just out of alignment, really, but constantly out of alignment, was corrected by doing Feldenkrais exercises, which are incredibly gentle and slow, and you don't think they're doing anything, and yet they're pulling your body back into alignment, and that helped my neck and my shoulder, which in turn helped my hand. So I began doing Feldenkrais before bed because that I knew would help my hand. I mean, there's certain particular exercises.
And you joined my Friday Feldenkrais
I
class,
did showing
where
your Friday.
we have one lesson a week, and you've enjoyed these lessons so much that I put some of them on the members only playlist because you are a member of my channel. So
That's true.
you can do them anytime you want. And I love Feldenkrais because, first of all, it's so effective. And, you know, it teaches you things that no one could teach you because it's internal. You learn through your own experience. But it's just wonderful because you can do it yourself.
Right.
The Feldenkrais awareness through movement lessons are done verbally through the teacher giving the instructions, and you make small, delicate movements. The student is in charge. If anything is uncomfortable, they stop. If they've had enough, they stop. It's really the safest way to move that I know of.
I've got to
And
pick up on that. I've got to pick up on that because you've got to hear what I said to my wonderful doctor, the one that didn't push me into surgery, but was very interested, because I went back to see him after 6 weeks of doing what Deborah had taught me. You know, you had given me so much, and I had really, honestly, I was in a very fortunate position of not living with anyone else. So living alone, I can do whatever I want, when I want, and how I want. So I was making up this new routine of doing the exercises and working with all the new equipment and so on. And I didn't have to take time to take care of anybody else at this point, which was fortunate. If I had, it would have been harder. But I went to the doctor and he said, "Well, how are things going?" And I said, "Well, I can put in my earrings with their backs, I can button my clothes, and I can cut with a knife. Things are going really well." And he said, "Really? How did that happen?" And so I told him about what Deborah and I had done together, and he was fascinated. So then he thought he'd test my reflexes and my nerves himself, because after all, I'm just a patient reporting to him. So he had a little wheel thing with had little points on it, and
sensory, yeah.
it was testing the tips of my fingers. So he tested first, he actually tested my strength. He had me gripping a metal contraption that I had to
Dynamometer.
squeeze, right, with both hands. And I was a little resentful, actually had his physician's assistant doing that. He wanted me to squeeze it 3 times. And I could tell 3 times was actually hurting my hands. It did not feel comfortable to do that more than once, and even once wasn't great. So when the doctor wanted to do it again, I said, "No, thank you." I said, "I've learned that my hands now are fragile. The nerves have been damaged, and doing something like squeezing that pressure metal contraption is going to damage them again, and I will have to spend several days taking care of my hands to help them recover. So you already had one test. Next time, if you want that test again, I'm only doing it once, if at all, but I'm really leery about doing anything to where it hurts. I've learned that's a mistake." And he nodded and he seemed like he was agreeing. And then when he did the testing on my fingers, he was amazed. He said, your fingers are nearly normal. The sensitivity has
Yeah.
increased." He didn't know what to say. So I said, "Yeah, I can tell you that. I can do my earrings. I can button a button." So he gave me a couple containers of putty to squeeze. And Deborah had warned me that squeezing exercises are not particularly good for this type of injury. So I was a little resistant, to say the least. And I said, "So what do you want me to do with those?" And he said, "Oh, no pain, no gain. Keep squeezing it
Oh
till
no.
your hand fatigues." And I said, "No, sir.
No pain, all gain.
Yes. So I said, I don't do that anymore. I said, I don't overuse my hands, and I don't go for pain. I don't think that's the way. I've been doing exercises that have improved everything by not taking myself to the point of there being pain or stress. So I will take your putty, and I will use it in a way that will be limited, and we'll see what happens. So he said, all right.
One of
So
the things that we do in my program is that we take the hand out of it. So when we're doing exercise, we don't squeeze rubber balls. We don't do wrist curls. We don't even do bicep curls with our hands, because this can really, it's not so much an issue with you, but for a lot of people, the forearm gets shot. And so you don't want to overdo it, because you can't get that kind of strength back. I mean, the tissue is too damaged. So doing strengthening exercises actually exacerbates and worsens repetitive strain injury for the most part. And, there may be times when putty is appropriate, but I am very leery about doing anything that's going to cause additional strain on already strained tissues and nerves.
right, right. Well, I totally am with you on that, Deborah. And I feel like what I also have learned is that when I'm fatigued, like going to this residency, which was a 10-day extravaganza of lectures and workshops and all these things, which are part of the program I'm in, I found that my fatigue just from walking around the campus of the college and, going from 9 in the morning until 10 at night, I could not keep my posture in the same state that I had been able to keep it in when I was living my life at home. And so I was concerned about that because I realized how critical my posture was to my keeping my hand in good shape. And I'm not sure what I'm going to do next time. I think having someone take notes for me was good. I, brought some support for my chair and all that when I couldn't use my special chair. But, um, every day there's another little adjustment that I need to make, and it's a process. But the fact that I've been able to get back as much capability, the cutting, dressing, my arms and hands don't hurt. So all of that to me is worth it. And I certainly know, and this is something that even the doctors admit, that if you keep on doing the same things, even after you have the operation, you may have that momentary recovery. But if you keep repeating the same problems, the operation would be pointless. And the
Yes.
thought of giving up
Yeah.
however many
Yeah.
months to
Yeah.
recover from an imposed
But I'm very happy you didn't have to go through surgery. I know
course.
so many people who've had bad outcomes with surgeries. And, anytime you can avoid it, sometimes you need it. Yes, you do. But when you can avoid it, the other thing is, I wish that more doctors would listen to me and listen to and make the connection between poor technique and the injury. Because if your doctor had done that, it would have been wonderful. And I know doctors don't have time to do technique retraining with people, but it really matters. It really matters. It's how people, can have the best workstation in the world. It can be state of the art, but if you keep slouching and you keep hammering your hands and you keep ulnar deviating and doing all the things that we talked about and that I showed you, there's no way you're not going to get an injury. Plus the sheer amount of time that people spend at the computer sitting sedentary is a huge risk factor for repetitive strain injury. So I got you that cute little timer.
I was looking around for it as you approached it, and it's on my living room, dining room table where I often sit with my chair and do some writing. And it's incredible because it alerts me before my butt starts to fall asleep. It's really good. So yes, it's so true. I don't know if we'll ever get doctors to listen. When I went into this school for the residency, I met with the accommodations director, the person who helps people with disabilities, which I am now one. And so she was very interested in all of this. And her mother, who's younger than I am, and she's obviously younger than I am, um, has some similar problems. But it was interesting to hear what the excuses and reasons were that her mother gave her daughter, who is in the business of helping people who have disabilities. Her mother said, well, I can't stop cooking, and I can't stop doing this, and I can't stop doing that. And she was willing to put up with the pain, apparently, because of her perception of who she was. And what I realized was, no matter what my age is, if I have this issue, I have to learn how to ask for help gracefully and understand that this is an opportunity to educate other people, because they're all sitting at their computers. And if they see what I have learned, then they might change their way.
You've helped a lot of people today. I really want to thank you for sharing your story, because now it will be widely available to people, and it's just good for people to know the process of how you got better, the things that you did to help yourself get better. This is really important because there's a lot of people who've unfortunately lost hope. They've been from doctor to doctor, physical therapist to physical therapist. They've tried everything in the world trying to get better, and they didn't have anyone who could show them the connection between what they were doing and their injury. So
Absolutely.
this is a great public service, and I hope that a lot of people hear this and take heed and find the help that they need. And it's just a really good thing. And I want to thank you so much for coming on. You'll find links to some of the products that we used for Patty's workstation, and they're listed in the details below. And be sure to watch the video that's coming up next for more great information about repetitive strain injury.